You know when you see certain dogs, like maybe a dachshund or a bulldog, with those really distinct short legs, you just wonder, well, what causes that look?
Yeah, it's something a lot of people notice. And it leads us perfectly into our deep dive today, actually.
Right.
We're exploring something called osteochondrodysplasia, which sounds complicated, but it's basically a developmental thing affecting how cartilage and bone grow.
Ah, okay. So that's the reason behind those unique shapes we see in some breeds.
Exactly. It's the root cause for many of them.
And we're looking at a veterinary guide, osteochondrodysplasia for this, so like an expert summary.
That's right. A pretty concise overview.
Okay, so our mission here is to really unpack what this condition is, why certain breeds seem prone to it, what signs to look for.
And what it all means for the animals themselves, their health.
Yeah, exactly. We want to get into it, but keep it understandable. So, okay, starting at the basics. What's actually happening in the body with osteochondrodysplasia?
So fundamentally, it's a hiccup in development. The normal way cartilage and bone grow gets disrupted.
An hiccup. Yeah.
It comes down to a process called endochondral ossification. Think of it like normally cartilage provides a model, and then it's gradually replaced by bone as the animal grows.
Right.
With osteochondrodysplasia, that replacement process, it just doesn't happen quite right.
So the body's usual bone-building plan gets sidetracked a bit. And where does this show up most, obviously?
Mostly in the limbs. What vets call the appendicular skeleton.
The legs.
Yeah, primarily the legs. And specifically, it often affects the growth plates, the metaphyseal growth plates. These are like the areas at the ends of the bones responsible for making them longer.
Okay, the growth engine rooms.
Kind of, yeah. Now, the guide splits this into two main types, achondroplasia and hypochondrodysplasia. The key difference is really severity.
Got it. Achondroplasia and hypochondrodysplasia. What's the distinction there?
Well, achondroplasia is more severe form. The cartilage growth is more significantly affected. This leads to what they call disproportionate short-limbed dysplasia. So noticeably short legs compared to the body size. And you usually see this right from the start or very early.
Okay. And the other one, hypochondrodysplasia.
That's a milder version. Still affects cartilage and bone, but the limb shortening isn't quite as dramatic.
Right. And it's fascinating how this isn't just random, is it? It's really concentrated in specific breeds.
Absolutely not random. A lot of this comes down to selective breeding. Humans chose dogs with these shorter legs. Maybe they liked the look or it suited a purpose.
Like dachshunds going down badger holes, maybe?
Potentially, yeah. And they bred them to keep that trait. But it's important to remember, sometimes selecting for one trait, like bone structure, can unintentionally affect other things.
Like what?
Well, sometimes even the eyes, the ophthalmic system.
Interesting. Okay, so for the really classic short-legged breeds like bulldogs, pugs, they'd be the achondroplastic type.
That's generally right. The guide lists the bulldog, Boston Terrier, pug, Pekingese, Japanese Spaniel, and Shih Tzu as typical examples of achondroplastic broods. That's why you see that more pronounced effect.
Okay. And the hypochondroplastic ones, the milder form. I'm thinking dachshunds, maybe corgis.
Spot on. The guide mentions dachshund, basset hound, beagle, Welsh corgi, dandy Dinmont terrier, Scottish terrier, and Skye terrier for hypochondrodysplasia. Shorter legs, yes, but often less extreme proportions.
Now, this is interesting. The guide also lists breeds with reported non-selected chondrodysplastic abnormalities. What's that about? It sounds different.
It is different. This means chondrodysplasia has been seen in these breeds, but it wasn't something people were deliberately breeding for. It's not a defining breed trait.
So it just happens sometimes in these breeds.
Exactly. And the list is quite varied. Alaskan Malamute, Samoyed, Labrador Retriever, English Pointer, Norwegian Elkhound, Great Pyrenees, Cocker Spaniel. Interestingly, Scottish Terrier and Beagle pop up again here.
Oh, wait. Scottish Terriers and Beagles were on the other list, too.
They were, yeah. Also Scottish Deerhound, miniature poodle, French bulldog, and even the Scottish fold cat.
So why would Scotties and Beagles be on both lists?
Good question. It probably means there can be different genetic reasons for short legs within those breeds. Some might be the selected for type, part of the breed standard, while other cases might be due to different spontaneous genetic changes causing a non-selected form. It just shows the genetics can be complex.
Right. Hey, you mentioned ocular skeletal dysplasia earlier in labs and Samoyeds. That connects the bone issue directly to eyes.
It does. In those breeds, the genes causing the skeletal issues can also affect eye development. So you might see problems like retinal dysplasia, the retina not forming correctly, or even the retina detaching.
Wow. Okay, so that possibly ophthalmic systems thing is quite real then.
Definitely something to be aware of, especially in those specific breeds.
So if you have one of these breeds, or maybe a puppy showing some signs, what are the first things you might notice? You said it's not always obvious at birth.
That's right. The guide says they might actually look pretty normal when born. It's often in the first few months that you start to see their growth isn't keeping pace. It seems delayed.
Okay, so it creeps up a bit. And what would a vet look for during an exam?
Well, the limbs are the main focus, obviously, but the spine can sometimes be involved too.
Okay.
The key things are the long bones in the legs looking shorter than expected and often bowed or curved. Also, the main joints, elbow, knee, wrist, ankle, they might seem enlarged.
Bowed legs, big joints. Pretty visible signs. Anything else specific?
Yes, the guide highlights the forearm bones, the radius, and ulna. They're often badly affected because they don't grow at the same rate.
Oh, asynchronous growth.
Exactly. That mismatch is what often causes that sideways bowing in the front legs. You might also see enlarged wrist joints, and sometimes the paws turn outwards, which is called a valgus deformity.
And it's not just the legs, you said. Head and spine, too.
Potentially, yes. The upper jaw, the maxilla, might be short. That can cause an underbite. Relative mandibular prognathism is the technical term.
Got it. Underbite.
And the spine can have issues like hemivertebrae, which are malformed vertebrae, causing curves or deviations.
And the eye problems we mentioned, retinal issues, detachment,
Yeah.
those would need a specialist, I guess.
Yes, typically a veterinary ophthalmologist would diagnose those specific eye conditions,
Right.
but it's important to know they can be linked.
Okay, so we know what it is, who gets it, the signs. Let's talk about the why. What's the underlying cause? Is it always genetic?
It generally comes down to genetics, yes, but how it's inherited can differ.
Okay.
For those breeds where it's a characteristic, like the achondroplastic and hypochondrodysplastic types we talked about,
Yeah.
it's usually an autosomal dominant trait, which means an animal only needs one copy of the gene variant from either parent to show the trait.
Just one copy needed. Okay, that explains why it's so consistently seen in those breeds.
It does. Now, for the cases in breeds where it's not selected for,
Right, the non-selected list.
it's often autosomal recessive, meaning the animal needs to inherit two copies of the gene variant, one from each parent.
Ah, okay, so both parents have to carry it.
Yes. Or it could be polygenic, involving multiple genes working together. The guide also points out you often see multiple affected puppies in the same litter, which really reinforces that genetic link.
Makes sense. So if a vet suspects this, how do they confirm it and rule out other things that might look similar?
Well, first they do what's called a differential diagnosis. Think
Right.
about other possibilities,
Well-
like maybe the growth plates in the forearm closed too early because of an injury, trauma, but usually the history, the fact it's just those bones and whether it's one leg or both, helps tell the difference.
Okay.
Pituitary dwarfism is another condition they might consider.
So history and exam are key first steps. What about pictures, x-rays?
Oh, definitely. X-rays are crucial. They can show really specific changes.
Such as?
Things like the ends of the bones, the metaphysis looking flattened or irregular. The growth plate itself might look wider than normal. You might see bits of cartilage that didn't turn into bone properly, or just general irregularities in the bone formation. And you can also often see signs of secondary issues like arthritis or joint looseness. Because the mechanics of the limb are off, spinal x-rays can show those hemivertebrae, the wedge-shaped ones, if the spine's involved.
Sounds like x-rays give a lot of clues.
Mhm.
Is there a way to be absolutely sure, like a definitive test?
Yes. The most definitive diagnosis comes from a bone biopsy of the growth plate.
Taking a tiny sample of the bone.
Exactly. Looking at that tissue under a microscope lets them see the changes at a cellular level.
And what do they see microscopically?
The guide mentions things like disorganization in the area where cartilage cells multiply,
Right.
problems in the zone where they enlarge, and just generally abnormal formation of the early bone structure. It confirms the whole process is disrupted.
Right, confirms it right down to the cell level.
Okay.
So once it's diagnosed, what can be done? What are the treatment or management approaches?
This is where it gets interesting. For those breeds where achondroplasia is, part of the standard,
Yeah.
the guide actually says it's sometimes considered a normal abnormality, which really makes you think about how we define normal based on human preference.
A normal abnormality. That's quite a phrase.
It is. Now, for the non-selected cases, surgery generally isn't considered very helpful. Even procedures to, say, straighten a bowed bone might have limited long-term success.
So fixing it surgically isn't usually the answer. What about managing symptoms? medications?
Yes. Management is mostly focused on palliative care, keeping the animal comfortable. Pain relief and anti-inflammatories are key. The guide lists several common ones.
Why?
Drugs like daracoxib, carprofen, etodolac, meloxicam, virocoxib, topoxylin, and tramadol for pain. It gives example doses, too. These help manage the pain and inflammation that come with the abnormal joint stress.
So managing discomfort, not curing the underlying issue. What about joint supplements? Glucosamine, chondroitin. Are they helpful? The guide mentioned chondroprotective agents.
It does mention them, things like polysulfated glycosaminoglycans, glucosamine, chondroitin sulfate. They're often used. But the guide suggests their benefit in actually preventing the cartilage changes might be limited. So while they might offer some general joint support, they probably don't change the fundamental course of the condition.
Okay, so manage pain, maybe try supplements, but temper expectations about fixing it. What about long-term? What should owners and breeders think about?
Well, from a breeding perspective, prevention is key. The guide strongly advises against repeating breedings that produced affected pups, and definitely against breeding affected animals themselves.
Responsible breeding choices.
Exactly. And in terms of complications, the abnormal limb structure, the altered biomechanics, it can unfortunately lead to degeneration within and around the joints over time.
Which impacts quality of life.
It can, yes, leading to chronic pain or mobility issues for some.
That's tough. The very traits selected for causing potential long-term problems. What's the overall outlook then? Does it vary?
It really does vary. The guide says the expected course and prognosis depend entirely on how severe the condition is in that specific animal.
So it's a spectrum.
Very much so. Some might have quite mild effects and live comfortably with good management, while others with severe forms face bigger challenges.
Okay, so wrapping this up.
Yep.
Osteochondrodysplasia is, well, it's a complex condition affecting how bones and cartilage develop.
Right. Often deliberately bred into certain dogs, giving them that characteristic look we recognize.
But, as we've heard, that look can come with potential health issues down the line.
Absolutely. And understanding that genetic basis, the potential complications, it's just crucial for responsible ownership, for breeding decisions, for providing the right care.
It really underscores the impact we've had on shaping these animals, which leads to a final thought, maybe. Considering how much human preference has driven these physical traits, what are our ethical responsibilities regarding the potential health trade-offs? Where's the line between a desired look and, well, compromised well-being for the animal? Something to ponder.